Good evening, and thanks so much for joining us for this town hall on pediatric vaccines. Tonight, I'm joined by Dr. Davis, the LA County Health Officer, Dr. Tereshita, the Associate Director of Acute Communicable Disease Control, Dr. Yagane, a pediatrician with Public Health, and Hema Morales and Dr. Hema Morales Meyer, Director of Clinical Services. I want to thank all the parents that joined us tonight and all those who sent us questions. I also want to acknowledge how difficult your jobs have been during the pandemic and how much we appreciate all you've been doing to keep your families and communities safe. I want to recognize the parents that have emailed us recently, sharing your stories of the fear and the anxiety that comes when you're caring for a child that is sick and infected with COVID or one of the other severe illnesses that can affect children. We are sending prayers for full recoveries for your children. To start, I'll give an overview of how we'll run the town hall. We'll begin with some brief remarks from our panelists, and then we'll spend the rest of our time answering your questions. As a reminder, you can send in your questions in the chat on YouTube, Facebook, or Twitter. As displayed at the top, we also have live translation services during our event tonight. Para escuchar en español, por favor, llamas 888-664-1453 para español. For Mandarin, it's 888-664-1459. For Korean, it's 888-664-1454. Before we move to opening remarks from our panelists, let me share the most current information on the COVID-19 pandemic. Today, we reported over 4,400 new cases and 5 additional deaths. Cases continue to increase in LA County, as the average number of daily new cases reported over the last 7 days increased to about 4,500 from 1 month ago when the number that we reported was about 1,900. That's an increase of 130%. The case rate, specifically for children ages 5 to 17 in LA County, has increased 2.5 times to 648 new cases for every 100,000 children. 1 month ago, the case rate for children 5 to 17 was 259 new cases for every 100,000 children. Our 7-day average test positivity rate, that's the percent of people getting tested on a given day who end up with a positive test, has also increased, especially when we compare it to 1 month ago. Today, the rate was close to 5%. That's more than double what it was a month ago on May 1st, when that positivity rate was 1.9%, just about 2%. The high rate of transmission is, of course, also reflected at our schools. The number of cases among students and staff doubled in this past month, likely reflecting in part transmission that's associated with end of the year and holiday gatherings. For the week that ended May 22nd, there were 7,300 cases in schools across the county, of which 5,834 were among students and about 1,465 were among staff. If you look just back a month, for the week ending April 24th, we had a total of 3,600 cases, with about 2,890 cases among students and 730 cases among staff. School-associated outbreaks remain relatively stable, but also high. For the week that ended May 28th, we reported 17 new outbreaks, 7 in elementary schools, 5 in middle schools, 4 in high schools, and 1 in a day camp. Oftentimes, these outbreaks involve dozens and dozens, if not hundreds, of students. And finally, while hospitalizations remain relatively modest, these higher case numbers have now translated to an increase in the number of people hospitalized. Over the last 7 days, the average number of COVID positive patients per day in LA County hospitals was about 465. That's an increase of just about 100% from a month ago, when the average number of patients that were COVID positive in the hospital was about 236. Thankfully, the hospitalization rate for children ages 5 to 17 has remained stable, with about one child hospitalized for every 100,000 children, 5 to 17. With high rates of transmission across LA County, there is a need for continued caution as there is increased risk to our most vulnerable. That includes our essential workers, the elderly, who can get infected, seriously ill, or tragically pass away. The most important steps we can take is to be up to date on our vaccinations and boosters, wear that high quality, well-fitting mask when you're indoors around others, get tested if you feel sick, you're exposed, or you're gathering with others indoors. When we take these sensible health safety measures, we take care of each other. We do look forward to answering your questions tonight. And now I'm going to turn it over to Dr. Davis, the County Health Officer, who will provide some updated information about the vaccines and where we're seeing gaps in vaccination rates. Dr. Davis?
Thank you, Dr. Ferrer, and good evening to everyone who's joining us today. As Dr. Ferrer mentioned, LA County is seeing an increase in cases, test positivity rate, and hospitalizations. And the best tools we have to fight COVID remains COVID-19 vaccinations and boosters, and as Dr. Ferrer mentioned, wearing a high-quality, high-filtering mask. A lot of people still wonder how vaccines work and what's in them. Vaccines work by preparing your body's natural defenses to recognize and fight off germs that can make you sick. Some vaccines have dead or weakened versions of the germ. Others have substances made to look like part of the germ. The currently available COVID-19 vaccines teach the body to make proteins that look like part of the virus that causes COVID-19. They do not have any form of the COVID-19 virus, live, weakened, or dead. When you get a vaccine, your immune system responds by making antibodies, which are proteins produced naturally by the immune system to fight disease. Preparing your immune cells to respond to future infection and remembering the disease and how to fight it. If you are exposed to the germ after getting the vaccine, your immune system can quickly destroy it before you become sick. This is what makes vaccines so effective. Instead of treating a disease after it happens, vaccines prevent us from getting sick in the first place. And in some instances, if you get sick even after being vaccinated, it makes the disease less severe. And data shows us just how effective they are. Among all age groups, vaccines substantially reduce the risk of hospitalizations and deaths. Unvaccinated LA County residents ages 5 years and older were almost 5 times more likely to be hospitalized than those fully vaccinated, with the greatest impact among 65 and 79-year-old residents. The hospitalization rate for unvaccinated individuals ages 65 to 79 was more than 10 times higher than the rate for fully vaccinated individuals 65 to 79 for a 3-month period ending April 30th. For the 14-day period ending May 5th, unvaccinated residents ages 5 and older were almost 8 times more likely to die from COVID-19 than their fully vaccinated counterparts. And again, for residents ages 65 to 79, differences by vaccination status were more pronounced. Unvaccinated residents in this age group were 20 times more likely to die than those fully vaccinated. Vaccines remain a powerful tool across all racial and ethnic groups, and across all groups, those fully vaccinated have lower rates of hospitalizations and deaths than those who are unvaccinated. For instance, the hospitalization rate among unvaccinated Latinx residents was more than 3 times higher than the rate for vaccinated Latinx residents, and the death rate for unvaccinated Latinx residents was over 7 times higher than the death rate for their fully vaccinated counterparts. Despite their clear benefit, vaccines are not equalizers, and disparities in outcomes still exist, even among vaccinated groups. For example, the death rates for fully vaccinated Latinx and Black residents were about 3 times higher than the rates for fully vaccinated Asian residents. These differences reflect differences in exposures, community conditions, health status, and social determinants of health that put Black and Brown residents at higher risk for infection and severe outcomes. Unfortunately, we still have a lot of work to do to get more people in our Black and Latinx communities vaccinated. Currently, only 60% of Black residents and 65% of Latinx residents 12 years and older are fully vaccinated against COVID-19. And only 33% of eligible Black residents and 31% of eligible Latinx residents have received their boosters. I know my colleague Hema Morales will touch on just how easy it is to access vaccines, but for now, I'll turn it over to Dr. Dawn Terashita. Thank you.
Thank you, Dr. Davis, and good evening, everyone. I'm happy to be here this evening to discuss pediatric vaccines and how effective the COVID-19 vaccines are at protecting you and the ones you love, including our children. I will also talk about the timeline for vaccines for children 0 to 4 years old. With the current rates of high transmission and the fact that there could be additional variants out there, and they could be more infectious or deadly, it becomes even more important to get vaccinated and boosted. The vaccines continue to be one of the strongest tools we have against COVID-19. They are very effective in preventing infection and are extremely effective in preventing hospitalizations. We see substantial reductions in cases and hospitalizations among fully vaccinated individuals, and even more significant protection for people who are fully vaccinated and boosted. For instance, unvaccinated people were about 2 times more likely to get infected with COVID-19 when compared to those who are fully vaccinated but not boosted. When adding a booster dose, protection increased significantly, as those who were vaccinated and boosted were 4 times less likely to be hospitalized than people who were unvaccinated. The evidence remains compelling that reducing community transmission, hospitalizations, and deaths, and preventing strain on the healthcare system are best accomplished if more residents are vaccinated and boosted. But what about our youngest children, those under 5 who are currently unable to get vaccinated? Last week, the Food and Drug Administration Vaccine and Related Biological Products Advisory Committee, or VRBPAC, announced that they have set official meetings to review 2 important topics. The first topic is the approval of the Moderna COVID-19 vaccine primary series for children aged 6 to 17 years old and children aged 6 months through 5 years old. The second topic is the approval of the Pfizer vaccine primary series for children 6 months to 4 years of age. A reminder here that Pfizer is already approved for children who are age 5 and older. These meetings are set for June 14th and 15th, just about 2 weeks away. Pfizer has submitted a 3-dose primary series for approval for those under the age of 5. According to the data from their clinical trial, it was 80% effective at preventing illness from the Omicron variant, and Moderna has asked the FDA to approve their 2-dose primary series for children under the age of 6. The size of the dose is smaller than in adults for both brands of vaccine. During this meeting, the FDA's Committee of Independent Experts will review the safety and efficacy data of the vaccines in an open public meeting and make a recommendation on whether the agency should authorize the vaccine for these age groups. The process the FDA uses to approve pediatric vaccines is considered the worldwide gold standard and involves an intense and extraordinarily rigorous review of patient-level data from trials. Over the course of other vaccine rollouts over the past 2 years and previous, the agency's attention to safety remains vigilant and its communication with the public is timely and transparent when concerns arise. This is a process we can and do trust to do the absolute best for our children and ourselves. The data presented so far supports our plan to be able to vaccinate children in the 6-month to 4-year-old bracket in just a few weeks. Once approved by the FDA and the CDC, DPH will order as many doses as we can in our initial request and begin administering them. Over the last year and a half, DPH has partnered with a vast network of providers, and we have spent weeks preparing for this approval. We will also continue to focus on accessibility to the vaccines, especially in the areas of Los Angeles County that have been hit the hardest by COVID-19. However, while we wait in anticipation, it is important to mention that our children ages 5 to 11 are already eligible for a booster dose. Last month, the CDC expanded the eligibility of COVID-19 boosters to everyone 5 years and older. Children ages 5 to 11 should receive their booster 5 months after their initial Pfizer COVID-19 vaccine series. More than 4.8 million children have been diagnosed with COVID-19 in the US. Thousands of those children live right here in Los Angeles County. During this announcement, the CDC also recommended a second booster dose for those 12 and older who are immunocompromised. As Dr. Ferrer mentioned, our case numbers are still rising, and every day we are seeing more people die or become seriously ill from COVID-19. This, unfortunately, does tragically include young people right here in our county. Many people will still have lots of questions about whether the vaccine will be the right choice for their children. If you have concerns, we urge you to speak with your child's medical provider and check the CDC website and the public health website for updated information. Keeping our children safe keeps us all safe and gives us a path to recovery. As we wait for the approval of a vaccine for our youngest children, please review the last date of the vaccines for your 5 to 11-year-olds for booster eligibility, or if you've been waiting to vaccinate your children ages 5 to 17. COVID-19 is not going away, and we are on the cusp of another busy summer of activities and family gatherings and travel. Please visit vaccinatelcounty.com or vaccinatelosangeles.com for vaccination sites near you. Locations across Los Angeles County do not require an appointment. Many schools also have vaccination sites. Additionally, public health provides in-home vaccination appointments for people who are homebound and are unable to visit a vaccination site. Please visit vaccinatelcounty.com to fill out the online request form or call DPH Vaccine Call Center at 833-540-0473, open daily from 8 a.m. to 8:30 p.m. Thank you, and I'll now turn it over to Dr. Napa Yagana.
Thank you, Dr. Terashita, and good evening, everyone. Thanks for joining us to talk about pediatric vaccines and why they're so important in our fight against COVID-19. To start with, the benefits of the COVID vaccination outweigh the known and potential risks. As Dr. Terashita mentioned, children who get COVID can still get very sick. Many require treatment in a hospital setting, and in rare situations, we've seen children die from this infection. After getting COVID-19, children and teens can also experience a wide range of new, returning, or ongoing short and long-term health problems. At this point, we have no idea to tell in advance how a child would be affected by COVID-19. We don't know which child will contract multisystem inflammatory syndrome in children, or MISC. So multisystem inflammatory syndrome in children is a condition where 2 to 4 weeks after a COVID-19 infection, children can have inflammation infecting all the different parts of their body, including their heart, their lungs, their kidneys, their brain, their skin, their eyes, and their gastrointestinal systems. We don't know what causes MISC, but we do know many of these children with MISC had mild infection with COVID-19 2 to 4 weeks prior. And we also know that more than 90% of them did not receive their vaccine. MISC can be serious, even deadly. And most children who are diagnosed with this condition have received appropriate medical care and have recovered. So if you think your child might have MISC, you should contact your child's doctor right away. These symptoms can include ongoing fever. They often also will have cramping, stomach, abdominal pain, bloodshot eyes, diarrhea, dizziness, a skin rash, and some kids have vomiting. To date, we've had over 300 cases of MISC in Los Angeles County, which is another reason we encourage all our parents to vaccinate their children. Additionally, we know in Los Angeles County, we have many children and teens who have conditions that put them at increased risk for worse outcomes with COVID-19. These include very common conditions, including asthma, being overweight or obese, having diabetes, and having developmental delays. Children and teens with one or more underlying medical conditions are more likely to get severely ill from COVID-19 and require hospitalizations. We ask you to help us in making sure these children stay up to date with their vaccination. We also know that children and teens who have developmental disabilities, such as cerebral palsy, intellectual disability, or autism, may be more likely to experience mental health conditions from social isolation. They also can experience barriers to getting needed healthcare and other supports because they have some characteristics that may increase their risk of COVID-19, including limited mobility, need for important support services, challenges with preventative measures such as wearing masks consistently, and then many have challenges communicating their symptoms. I understand there's a fear and uncertainty if you have a child with an underlying medical condition, but the vaccine has been shown to be safe and effective. In the clinical trials for Pfizer vaccine, about 20% of the children and teens who participated did have an underlying medical condition. If your child should get COVID-19, or if they have symptoms of COVID-19, and they're at higher risk for getting sick, we do want to make sure that everyone knows there are medicines that can treat COVID-19 and keep them out of the hospital. Your child could get tested right away, and if they're at higher risk and they have symptoms, and they're 12 years of age and older and weigh more than 88 pounds, they can get Paxlovid. You would have to make sure to get them treatment as soon as possible. The earlier you get the treatment, the better it works. Additionally, if you have a child whose immune system is not strong enough to mount a response to the vaccine, or if they can't receive COVID-19 vaccine for medical reasons, it's really important to talk to your medical provider. There is an injectable medicine called Evusheld, and it's available to help prevent COVID-19 in people who can't get the COVID-19 vaccine, or individuals who are moderately or severely immunocompromised and don't mount an appropriate response. This again is Evusheld, and it's available to children 12 years of age and older as long as they weigh more than 88 pounds. You can also visit publichealth.lacounty.gov/COVID medicines for more information and where you can access these treatments. I'd like to hand it over to Dr. Hema Morales-Meyer now.
Good evening, and thank you for joining us. As cases continue to increase across the county, there are 3 important steps we should take. First, as others have mentioned, vaccines remain the best way to protect yourself.
Can I just stop you for a sec, because it's a little hard to hear you? Is there a way you could either talk louder or get closer to the mic?
No problem, and I'll start and repeat myself.
Okay.
Is that good?
Yeah, you're fading in and out, so probably just stay close to the mic.
Will do. As cases continue to increase across the county, there are 3 important steps we should take. First, as others have mentioned, vaccines remain the best way to protect yourself and those around you. They are safe and effective and recommended for everyone 5 years and older. Vaccinations are always free and open to eligible residents and workers regardless of immigration status, and appointments are not needed at public health vaccination sites and at many community sites where first, second, and third doses are available. To find a vaccination site near you or to make an appointment, please visit vaccinatelacounty.com or vacunatelosangeles.com. If you need assistance, you can also call 1-833-540-0473 for help finding an appointment, connecting to free transportation to and from a vaccination site, or to schedule a home visit if you are homebound. We know that vaccinations provide powerful protection against COVID-19, but the number of county children ages 5 to 11 fully vaccinated stands at only 33%. This is far below all other eligible age groups across LA County and creates significant vulnerability for increased spread of COVID. Also, the data continues to show us that our immune systems need to be boosted. So we urge you to get your 5 to 11-year-olds boosted if they are eligible. While you don't need an appointment at many places to get a first, second, or third dose, it is very easy to make an appointment for a booster dose. You can go to myturn.ca.gov or to our website at vaccinatelacounty.com to make an appointment. And for more information about booster shots, you can get vaccinated at any of hundreds of mobile sites or at one of our more than 2,000 fixed sites countywide. Additionally, many pharmacies and clinics countywide may be accepting appointments through their own systems. If the place where you got your primary vaccine series was convenient for you, you can check back with them now to see if they are offering booster doses. All you need to bring with you to your appointment is proof of your primary vaccine series, such as your white vaccination card, a photo of your vaccination card, a medical record that documents you have received these vaccines, or your digital vaccine record. Also, you can safely get your first, second, or third COVID vaccine at the same time you receive other vaccines, including flu shots. The best schedule for getting both these vaccines is the one that doesn't delay either of them. All of the county DPH sites and most pharmacies are offering both COVID and flu vaccinations. And for children, there's an enormous network of providers countywide to provide vaccines to children. Approved providers include pharmacies, federally qualified health centers, county sites, pediatricians, and family medicine practices and clinics. School vaccination sites form another pillar in our vaccination plan. Many parents have requested that we offer vaccines to children and teens at schools because these are in familiar and trusted places. School vaccination clinics have already been an important part of our community vaccination strategy. Please note that a consent form is required for all minors ages 5 through 17 at each visit. Children aged 5 through 15 must be accompanied by their parent, a legal guardian, or a responsible adult. If the child is accompanied by a responsible adult, the consent form must have the name of the responsible person and be signed by the parent or legal guardian. Also, 16 and 17-year-olds should be accompanied by their parent or legal guardian if possible. If this is not possible, they must bring a consent form signed by their parent or legal guardian. If the minor is being vaccinated at school, consent is required. However, the school's guidance should be followed on whether a parent or legal guardian or named adult needs to be present. And as soon as vaccines for children 0 to 4 are approved, we will continue to provide information and the requirements to you all. And now I'll turn it back over to Dr. Ferrer so we can start answering questions.
Thank you so much, all four of our doctors, for providing some, I think, really important basic information. We do have a ton of questions. So just for starters, like if we don't get to your specific question, we will be posting additional responses on our website. And sometimes questions are pretty similar. We could have 2 or 3 or 4 questions on the same topic. So you might not hear me read your exact question, but hopefully for most of you, we're getting you the information you're hoping to get tonight. I'm going to start with Dr. Wane. Is the vaccine still emergency use only? And what are possible side effects on children?
Yeah, that's a great question, and thank you for asking it. So the 2 vaccines that are right now FDA approved are the Pfizer product under the brand name Comirnaty and the Moderna product under Spikevax, and those are the formulations for adults. So for Moderna, it's 18 of age and older, and then for Pfizer, it's 16 years of age and older, and those have been licensed. They've gone through the entire process. The pediatric products, the Pfizer product, which is available for those who are 5 years of age to 15 years of age, those are authorized. And so that means that the FDA did review the data. It went through all the different processes, and the submission has been made to the FDA to get full licensure. So those are still it's an authorization for emergency use while the process is ongoing. So it is fully approved for some age groups, and it's authorized for our pediatric population. And we expect that the FDA is reviewing the data for full licensure soon.
I think it's important to note, like, this is the process for many medications that are needed on an urgent basis. So they can be released. They will never get released if there's not enough information to show 2 things. One is that they're effective. Like, we need to know for sure before they get authorized that they're effective. They're going to do what they're supposed to do. And the other is that they're safe. that the benefits of taking that medication far outweigh any of the risks, and that the risks are known. You know, you can't know everything, but you've done enough studies around safety that you've been able to establish that this is a safe medicine. So I just want to provide some reassurance that while we all look forward to having them fully approved, that means they've completed the entire process. No drugs in the United States can be sold unless they've gone through that rigorous safety and effectiveness review. And that means that they've been studied, that scientists, not from the drug companies, have been looking at the data and the information and established that these medications, particularly around vaccines, are both safe and effective. What about the possible side effects?
So for the children who are 5 years of age to 17 years of age, the general side effects are very similar to adults, if not less so for children. They usually will have a little bit of soreness where the injection site is. Some people might have a little bit of redness. And then a smaller percentage of children might say that they're feeling tired. They might have headaches and muscle aches. Again, these side effects may limit their activity for a few hours. So, and you can give some Tylenol and Motrin if they do have these effects. Not everyone will get them. I would say that most of the children that I've talked to who've gotten the vaccine haven't had these side effects, but it is considered to be a normal side effect. And it just shows that the body is building immunity. There are some very rare but serious side effects that have been well described but are extremely rare, especially for the 5 to 11-year-olds, including the inflammation of the heart. It's about 1 to 2 per million doses given. And then again, similarly, some people can have an allergic reaction to the vaccine that can be treated. And again, that's very uncommon, and it ranges between 1 to 2 per million doses given. So extremely rare adverse events, but in general, the effects are, mild pain and redness.
And we all know a lot about adverse effects. Every medication that we take, even as adults, has a list of like side effects, and usually has some kind of disclaimer about warning you that you could have some severe reactions. So again, I want to note that the medications are really super safe, or we wouldn't be in front of you tonight recommending them. We understand parents have to weigh lots of different factors, and we don't know all of the issues that you're grappling with. But in terms of safety and efficacy of the vaccines, we're very comfortable that these vaccines were approved because they are safe, they are effective. The risk of getting COVID, even for children, is more serious than any of the risks that have been associated with the vaccine. So hopefully, if you still got questions about that, you'll feel comfortable either calling us up at our call center. We're always happy to hear more directly from you, or talking with your pediatrician or your healthcare provider. I'm going to move on to Dr. Terashita. Why would children need more than one shot of the vaccine, similar to what adults needed, when they're smaller and they're at lower risk?
Hi, thanks for that question. Well, children need more than one dose of vaccine, and I'm not sure if this question is related to the booster dose, which I'm assuming.
Think it's a booster dose. I think it's just about a two-part series.
Two-part series, yeah. Well, there's a few reasons. One of the reasons is that for the Pfizer dose, pediatric dose from 5 to 11, it's actually a smaller dose, lower dose. They did studies in children, and it's a way to reduce the side effects in children and give them the same effectiveness, vaccine effectiveness. So they give a lower dose, but they give more vaccine, and this is the same theory behind the younger dose series from the 0 to 4-year-olds, which is proposed but not approved yet. As far as why would you need a booster, which is also a very good question. Boosters because you have waning immunity, both from the vaccine as well as from natural infection. As time goes on, you lessen your immunity and your protection. So we need to boost with vaccine to boost that protection right back up.
Yeah, that's great. And actually, we've got a lot of questions on why does immunity wane after boosters? So maybe Dr. Davis, you could take that. Sort of what's the science behind waning immunity from these vaccines? This person notes appropriately that for some of the vaccines they've had, they only need to take the vaccine once.
Yeah, and that's very true for a number of vaccines, but not true for all. There are many of them that we do have boosters for, including those that are given for tetanus, for diphtheria, as well as for polio, among others. And it really is just that the immune system, although it's still primed to fight against whatever you were vaccinated against, the strength of that protection just seems to wane over time. When you initially get a dose of vaccine, there's a surge of immune cells and antibodies that sort of act as a frontline defense against that germ that you were vaccinated for. And then over time, those naturally start to fade and wane, but they don't reduce to zero. And so this is normal. And as mentioned, there are other vaccines with which you need a booster for. And in general, there are still some longer lasting memory cells, but the booster helps to make your response stronger so that you have a better defense against whatever it is you were vaccinated against. But again, this is something that we've seen with other vaccines. It's not unique to the COVID vaccine.
Thanks so much, Dr. Davis. Dr. Morales Myers, what will be the requirements for vaccinating the youngest children 6 months to through 4 years of age? And will my child need to be a certain weight if they're in this age group?
So at this time, we are still receiving information and they're still reviewing the data. We know that children need to be at least 6 months of age, and not sure of the requirements for weight at this time. I don't know if anyone else wants to chime in, but we are aware that they do have to be 6 months of age and older in order to receive these doses. And more information will be coming out, so we will be sending that information to you all once it's approved and fully authorized.
Thank you. I don't know if Nava, I don't know if you have any additional information on the weight question.
I believe that Dr. Morales Meyer was right. It is for 6 months of age and older. So we are looking for vaccine products. For Moderna, it'll be 6 months to 6 years of age, and for Pfizer, it's 6 months to 5 years of age. And we'll have a lot more information as soon as the FDA has their public meetings on June 14th and 15th, and we'll be able to distribute that information out as soon as we have time to review it ourselves.
Yeah, thank you so much. Dr. Terashita, do you know why we're bothering with a vaccine for children if deaths are so low in children? How effective is it actually against infection, particularly Omicron? And what is the worries about complications?
Yeah, that is a good observation. Our deaths are much lower in the pediatric population, thank goodness. However, we have had thousands of infections in children, as Dr. Furr mentioned, and we've had many children who have had severe illness, and even unfortunately, some children who have died. To us, any child who dies of a vaccine preventable disease is a tragedy. So this is the reason why we push our vaccines even in our pediatric population. And these are individuals we do not want to get severely ill and unfortunately pass away. The efficacy varies. So the initial studies for the Pfizer vaccine that was during the Delta phase was very good. Efficacy was close to 90% for children. With Omicron, it has gone down. I think, Dr. Yagana, did I hear you say about 80% for Omicron?
Yeah, I think different studies have 60 to 80% with the just 2-dose series, not with the booster.
And as Dr. Ferrer mentioned, there's been very few complications. It's a very safe vaccine. Most of the adverse events have been similar to what Dr. Yegana said, with just sore arm, fever, chills, fatigue, very similar to the side effects in adults.
Yeah, I think probably a couple of things like it's important for us to remember. You know, before we had a vaccine for rubella, before we had a vaccine for chicken pox, there were very few deaths associated with those diseases as well. But again, they were very infectious. Lots of people could get infected. These are not only diseases that happen among children, they also can happen amongst adults, and they can also happen among children who have serious underlying health conditions and will be at higher risk. So whenever we think about why we're all getting vaccinated, you know, partly it's to protect ourselves and partly it's to protect other people. And I know sometimes, you know, I've talked with parents and they've noted like, you know, I don't want any part of, you know, my child taking a risk so that other people will have protection. But we do that all the time. We're always protecting, we're always taking steps to protect each other. Like that's sort of the pact we make. And it's very hard to get out of it with vaccines. And one of the people that could be protected could be a parent or a grandparent or a cousin or an aunt or a teacher at school. So I think we need to sort of broaden our view of what's happening here. The truth of the matter is, if we had more people fully vaccinated and up to date with their boosters, we would have less transmission now, and that would mean we would have less variants to be worried about. So getting vaccinated, you know, helps all of us and allows us as an individual that is vaccinated to have some security in our protections. Sometimes I think it's hard for us to remember how connected we are with each other, and that like with many other vaccines, we get our children vaccinated so that we create a lot more safety in schools. We create a lot more safety in our communities. I'm gonna move on to, let's see, we have so many good questions here. Dr. Davis, again, same theme, but I think worth answering this particular question. Since it sounds like COVID's always going to be here, why bother having my child get vaccinated? I'm nervous that the vaccines are so new, and I'd rather my child just got infected and got immunity through the infection. I don't see much difference in the vaccines and in just allowing children to get infected.
It's a great question, and as mentioned, with the vaccines, we don't see MISC coming from the vaccines because they don't actually have the virus. So a child who gets infected could have that longer term, more serious consequence of being infected. We don't, see with the vaccine people who are around children, getting infected because they're protected if they aren't infected. And so really the vaccines have been given to millions of people and, hundreds of thousands of children as well. And, they're still under and will continue to be under intense safety monitoring. And they've been proven to be effective. Both from looking at the tens of thousands of participants in the clinical trials, as well as the FDA's rigorous scientific standards regarding safety and effectiveness and manufacturing quality that's needed to support the authorizations that they've received or the approvals that they've received thus far. And we have to remember that this disease, again, is transmitted person to person. So by getting someone vaccinated, it protects them, as well as what Dr. Ferrer mentioned, it protects others. Many know when flu season comes around and a child gets sick, then the household is sick as well as their classmates also. By getting vaccinated, you reduce the risk of one, getting infected, two, of any severe illness from that infection, and then you reduce the risk of transmitting that infection to others because you're protected as well. And again, reducing the risk of any long-term consequences of being infected. So it's much safer to be vaccinated and much more effective to be vaccinated than it is to take the risk and see if your child gets infected and has a serious consequence or unfortunately dies. So it's a much safer way to go.
Yeah, I think that's super helpful, Dr. Davis. And, it's a good segue to the next question, which is, about developing heart problems from the vaccine. I know different people touched upon this, but I think we've got a few questions on this. So I'm going to ask maybe Dr. Jagane to just help with this. But one thing it's important to note, we have a lot of people worried about heart problems related to the vaccine, but we have a much higher rate of people developing heart problems, including children who have gotten ill with COVID. So we should just remember, very, very rare for that to be a side effect from the vaccines. Much more common, actually, for children who have actually had COVID infection. But this is a question from a parent, Dr. Yodane, just about, are there some children more at risk of developing heart problems due to the vaccine? And then this parent, her child has Brugada syndrome that can cause a dangerous irregular heartbeat. And she's concerned about whether or not her child should get vaccinated. So I think the first part, I think, is important for all of us. The second part might be helpful both for this parent, but also for other parents who have specific questions around safety of the vaccine.
Sure. So we touched on it briefly, but there is this rare but serious side effect, adverse event from the Pfizer vaccine. It can cause, and Moderna vaccine, all the mRNA vaccine products, it can cause this inflammation of the heart muscle, which we call myocarditis, or inflammation of the outer lining of the heart. And that's called pericarditis. And it seems to be most commonly seen in males between the ages of 12 to 39 years of age. So it's a thing that is much more common in older children and adolescents, and much less common in the 5 to 11-year-olds. This has been investigated. Luckily, it seems like most of these children and young adults who get this, they do recover quickly within a day or two. We've also learned to lower the risk of myocarditis. You can give the second dose a little bit, extend the interval between the first and second dose. So that seems to make myocarditis a less likely outcome. So there is that option. If you choose, you can separate the Pfizer dose by 8 weeks instead of 3 weeks. I think I've mentioned also that the booster dose, it seems like it's the risk of myocarditis is much lower than what you would see with the second dose. So, if this is something that's concerning to you, definitely talk to your pediatrician. If you do have a child who has an underlying heart condition, hopefully you have a cardiologist that you trust. I've spoken to my colleagues who are cardiologists, and I think all of them feel that it's incredibly important to vaccinate. And I think Dr. Ferrer mentioned this because the risk of having heart conditions associated with COVID-19 are much greater than getting it with a vaccine. So if your child has a heart condition, they're much more likely to have an adverse outcome by infection versus the vaccine. And that's been studied, that's been shown in multiple different publications, where the risk is roughly anywhere from 2 to 70 times higher with infection than vaccine, even for adolescent males with their second shot. So I think, again, I would talk to your trusted cardiologist, but in general, everyone who I've spoken to agrees that the most important thing you could do is to protect your child from COVID-19 by getting them vaccinated.
Thank you so much. Dr. Morales, Meyer, a couple of questions that I think can actually go together well. One is, can I be there when my son gets vaccinated? And the other part of that is, what's the best way to make my son not scared to get the vaccine? He hates getting shots.
That's a great question. And yes, absolutely, parents can be there when their child is getting vaccinated. And actually, just as a reminder, if they're between the ages of 5 to 14 years old, 15 years old, they do have to have either a parent or a parent guardian or a responsible adult with them when they're getting vaccinated, and they do have to have the parent's consent. Now, it's always good to talk to your children before getting vaccinated. They want to know what's going to happen to them, so they want to know the process. So it's good to let them know what is going to happen, how long it's going to take, what they should be expecting, and letting them know that you're going to be there or whomever is going to be there to support them, and talk with them, explain to them what that process is going to look like and what they're going to feel, so that they know ahead of time what to expect and relieve the anxiety. I always tell my kids to, the nurses are great at distracting children when they're getting vaccinated as well too. So maybe using some form of distraction when they're there with them, that is a safe way to make sure that they reduce their anxiety and just do it. But there are many children who don't like vaccines, and then there are others that do well with vaccines. So really talk to your children and see how they feel about it.
Yeah, I think, also, try to take your child somewhere that's really going to be comfortable giving pediatric doses. I know at our sites, we have a special place set aside, staff that are specially trained to, help children get comfortable. We have books, we have toys, so if you have a child who's hesitant because they hate shots, and lots of children do, I would suggest you also look for those sites where they're going to really, try to create a very welcoming, stress-free environment for children. I know I've been at our sites where, sometimes it's taken over an hour before a child feels comfortable enough to get that vaccine. And the nurses have been very patient and, just making sure the child is comfortable. So, I urge parents whose children are, really afraid and fearful and can, be very uncomfortable around sites where they need to get those vaccinations, to find those sites that are willing to take time to get your child to feel comfortable. And again, these are situations where it's good to have parents or a familiar adult with the child, because I think that helps as well. A couple of, I think really, again, good questions here. I'm going to try to combine them just because we have so many questions to get to still. But maybe Dr. Teresita, there are questions about what kind of protection do infants have whose moms got vaccinated while pregnant and boosted while breastfeeding?
Thanks, Dr. Ferrer. Actually, could I turf that over to
Yes, absolutely.
Dr. Yagana?
Yes, absolutely.
The question was about getting vaccine while they're pregnant or breastfeeding. Is that correct?
For moms, what kind of protection does an infant have if a mom got vaccinated while pregnant and boosted while breastfeeding?
Oh, that's an excellent question. I think that's really important protection. So many of you know that the antibodies that mom produces get transferred to the infant. So if you get vaccinated while you're pregnant, you do form antibodies, and those antibodies are then passed on to the infant through the placenta. The vaccine itself is not transmitted, but the antibodies, the protection you have built, do get transferred to the baby, usually in the third trimester. Around 32 weeks. And that baby then has those antibodies and is protected. And there's been multiple studies now showing how incredibly effective those antibodies are at keeping babies safe from COVID-19. As far as breastfeeding goes, when you get boosted, you form, again, additional antibodies. Those antibodies can be transmitted through breast milk. So those are very important antibodies that give an additional layer of protection to the infant. And so I think that getting vaccinated and getting boosted during pregnancy and during breastfeeding are excellent ways to protect your infant. And these are unfortunately infants that we are not going to have a vaccine product for. So this is the best way to keep them safe. safe is just to make sure that pregnant women and breastfeeding women are vaccinated.
Yeah, thanks. Dr. Degane, there's a corollary question there, pretty similar. I'm currently pregnant and vaccinated. At what month should I get my second booster so that my unborn child will have the greatest amount of antibodies when born?
So excellent question. Like I mentioned, if you get your vaccine during your second or third trimester, that seems to provide the highest degree of protection. As long as, I would just probably get it during the second and third trimester, because in case you go into preterm labor, you want to make sure you have enough antibodies transferred. So that's probably what I would recommend. As a reminder, the second booster dose is recommended for people who are severely or moderately immunocompromised and anyone who's over the age of 50. So if you're in one of those categories, please go ahead and get your second booster.
Dr. Terashita, this is I think an important question as well, and we have it in a few different places, sort of a similar inquiry. My son is 9 and he received both vaccines, but he did get COVID with moderate symptoms. I'm confused about what I should do about the booster because he got a cold last week and he fought right through it. The cold wasn't COVID, but she's wondering if he built up enough immunity fighting off the cold that he doesn't need the booster.
That's a good question. Unfortunately, the common cold viruses really don't confer any protection against COVID-19. So most of the common cold viruses could be like rhinoviruses or enteroviruses or adenoviruses. There's many, many different types of viruses out there, and they're not COVID-19. So the way immunity works is that your body builds immunity to the viral infection that you got. So in that situation, I would still definitely recommend getting the COVID vaccine.
Thank you. Dr. Davis, a few more general questions. So, and we'll come back to more specific questions about vaccines in children, but we're planning summer trips involving air travel out of state to visit elderly relatives who are in their 80s and 90s. All of us are vaxxed and double boosted, and we plan to remain double masked on the plane. When and how often should we test ourselves before and after landing to help ensure that we're not posing a COVID-19 risk to the seniors in our family? And this family has adults and children. The adults, the children aren't.
Okay. So first off, great that you're vaccinated and double boosted. That's step one. Number two is before travel, of course, reduce your risk of exposure as much as possible, but do get a COVID test as close to time of departure as possible, but no more than 3 days before your scheduled travel. And then, of course, only travel if your test is negative. And then during transportation, whether you're on a plane, a train, a bus, wear your mask, even if you're not in LA County, and inside transportation hubs, just because you're around lots more people and their potential for exposure, will be greater in those settings. And then after you travel, get a COVID test 3 to 5 days. You could do it 3 to 5 days after travel if you're going to be there for a longer period of time. While you're there. And then I would say, wear your mask around, your family members, especially if you haven't done that retest after travel, if you're going to be there again for that longer period of time. That just reduces the risk for everybody. And then if you're going to do things with them, try as much as possible to do them outdoors. You have better ventilation, so that reduces the risk of if you are unknowingly infected or they are unknowingly infected, that it reduces the risk of transmission to anyone who's involved in the get-together.
Thank you. Dr. Morales Myers, a couple of questions around the vaccine card. So one is I lost my vaccine card, and so how do I get another one? And then similar to that is a question for somebody who got their second Pfizer booster back in April, but it hasn't been added to their record. What can they do to get that fixed?
That's a great question. So if you or your relative was vaccinated in California, you can go to the state website to receive your digital vaccine record. And the website for that is myvaccinerecord.cdph.ca.gov. And that's pretty long to remember. So if you don't remember that, you can go to our DPH website and visit the vaccination records page. And we will have instructions there on how to request your digital vaccine card. On that same page, we also have information on how to access the state website to make corrections to your vaccine record. And we've seen a lot of this where there are sometimes missed doses. So you can show them, present the proof once you click on the vaccine website, submit that information, and they will make the changes. So everything goes through our state website. And that website is myvaccinerecord.cdph.ca.gov.
Hema, if somebody needs help, they can't really use their older person, they don't speak English, they can't really navigate the CDPH website, can they call our call center and have somebody help them do this?
Absolutely. Our call center is open 7 days a week from 8 a.m. to 8 p.m. And staff are available to help in multiple languages. And you see that on your screen right now. So you have that number and you're able to call to make any, to get assistance with appointments, get assistance with transportation, get assistance with your vaccine records. And there's a number of things, including therapeutics, that are at this call center. So absolutely, everyone can call and get the services that they need and help with what they need.
Yeah, so for the person who sent in all their specific details about needing that second Pfizer booster to show up on their card, perhaps you can call us at that call center number. We're open right now, so you can actually give a call right now. You could say we sent you to that number and ask them to help you figure out how to get that fixed, because we appreciate that you want your vaccine card to be accurate. And the same applies for the person who lost their vaccine card. Give us a call and we'll walk you through what you need to do. And if you either don't have access to a computer or it's just hard for you, we'll help you actually figure out a way to get that replacement card. It's really going to be a replacement record. But as a good reminder, we do encourage everyone to take a picture of your vaccine card. If you're getting vaccinated at one of our sites, you're going to automatically get linked to a digital record. But, for those of you who like having a physical card, getting it replaced, you do have to go through the state and it'll be a record. And for those of you who want extra safety, take a picture of that card. So that, and especially if you're carrying a phone around with you, and then you'll have it with you at all times. I'm going to go back, Dr. Chikane. I mean, we've got a lot of questions about children who are almost 5, and should they wait for the new vaccines to come, or since they're pretty close to 5, and some of these children, the parents are saying, my 5-year-old is as big as my 7-year-old. Should I just go ahead? I mean, my 4 3/4-year-old is just as big as my 7-year-old. Do I need to wait for the specific dosing for children under 5, or can I go ahead and get them that vaccine for a 5-year-old now? And then I'll give you some variations on that as well.
So I'm a firm believer that you should get your child the vaccine as soon as they're eligible. So if you have a 4-year-old and the vaccine is available for 4 years of age, you should get that vaccine. When they turn 5, you can potentially then get the appropriate vaccine for that age. So I think that I wouldn't wait just because unfortunately we are seeing a lot of transmission of COVID-19, and that might affect your child and before they have a chance to get vaccinated. So I think that's my, that's my opinion on it. And I think that's what the CDC has recommended to this point. We, of course, will get more information once we have the CDC meeting specifically to discuss this vaccine products for children under the age of 5. And I just want to, kind of just give you a little bit of biological reasoning behind that. We really just understand that your immune system it doesn't matter how much you weigh, your immune system is really dependent on your age. So the maturity of your immune system depends much more on age, and that's why we use age cutoffs and not weight cutoffs when we're talking about vaccine products.
I think that's super important. So the what other question I was going to just ask that was very related was, I have a small 5-year-old who's below the 50th percentile. I'd rather we wait and he get the dose for children under 5 because he's little. So maybe just repeat.
Yeah, I again would say that in pediatrics, we really look at the child's immune system, and that is dependent on their age and not their weight. So I know a lot of medicines, we do look at weight and we want to make sure we weight adjust, but for vaccines and other things that rely on your immune system, we look at age because that's a much better indicator of how they'll respond to the vaccine product. And as many of you know, we give a tiny little bit of vaccine. So it's it really is just enough to get to be appropriate for their immune response to be active. So again, not based on weight, based on age. And that's a marker for how their immune response will be.
Yeah, thanks so much. I think it's such a good question, and we get it all the time. We've gotten it for, kids who are, 11, should they get the older dose? The dose for the older kids? Should they get the dose for the younger kids? And then we get a lot of questions about, I got my first dose. My child got their first dose when they were 11. When it's time for their second dose, they're now 12. So maybe you could go ahead and sort of explain that, because it will also apply to children who may be close to 5, get their first dose when they're still under 5, and then would be eligible for that second dose later.
Yeah, so because these vaccine products do expand many months, it's very important that you give the dose that's appropriate for your child's age. So if your child is 11 when they get their first dose and they turn 12 before they need their second dose, for the second dose, I would go ahead and give them the product for 12 years of age. To 15 years of age. So there are different products based on ages, but I think it's very important that you get the right product for their age and you get it when they're eligible. So I again would hesitate to wait when we have such high levels of transmission of COVID-19 right now. So I would just go ahead and know that their immune response will be robust, based on all the data we have so far. It does seem like it does work, and so far, we haven't seen any adverse outcomes from doing that.
Yeah. And then just a couple of questions around the timing of the second dose for children, 5 and older now. We've got a very well aware parent here who's noted that CDC has now expanded the time frame from the first dose to the second dose in the initial series. And she wonders, because it's a range now, she wonders what our recommendations are for that initial series, what the timing should be between dose 1 and dose 2. And this is for the vaccines already approved, children 5 and older.
Right. That's an excellent question. The CDC did review the data from other countries where they have a longer interval between the first dose and the second dose. And they found that when you have the longer interval, there is, a smidge better protection and maybe lower risk of myocarditis and pericarditis. However, like I mentioned before, when you have times when you are very much worried about infection because your child is moderately or severely immunocompromised, or if a child, is going to be traveling to a high risk area, or if your child, or, you have high community levels like we have right now in Los Angeles. In those situations, you might want to opt to go ahead and give them all that protection a little bit earlier. So there is a little bit of flexibility allowed, that you can go anywhere from 3 to 8 weeks between the first and second dose. And this is something that you can discuss with your provider. We'd be happy to discuss it with you as well. But, there are considerations about, where your child's risk level is. If you want to get them fully protected faster, I would go ahead and opt for the 3-week interval between the first and second dose. If you have a lot of concerns about myocarditis, or if your child is relatively well sheltered from the high transmission rates in the community, then you can opt for the 8-week interval between the first and second dose.
Thanks so much. I'm going to just give you a couple more questions because they're very specific about the timing of the doses. So this is a question, and we have it like from 5 different people, about timing the booster doses for children between the ages of 5 and 11, now that they're eligible for the booster doses. When is a good time for my kids to get the booster shots? One child is 8, one child is 10. Should I wait for the fall when there's both flu and everyone is saying there's more worries about a bad COVID season? My assumption is from this and the other questions here is these are all children who are currently immediately eligible to get the booster dose right now.
Yeah, I think this is a really important question. I do think that a lot of parents are thinking this way, and unfortunately we are in a time of really high COVID-19 transmission. So my recommendation would be to get your child up to date as soon as possible to protect them. I know that we're thinking in the fall there might be more transmission, but the truth is we don't know what the fall will bring. We don't know what will happen as far as new boot variants, how well different vaccine products what will be available. So I think what I would really encourage everyone to do at this time, we know we have a safe and effective booster product. We know we have a time of very high transmission. We also know we're heading into the summer period where people are going to be possibly traveling and maybe engaging in with different groups of people in camps. So my opinion would be to go ahead and protect your child as soon as possible and get them up to date with their vaccines.
Yeah, thanks so much. Dr. Terashita, we have this question both about adults and about children. 5, and these are children who are over 5 eligible to get both vaccinated and in some cases boosted. We have questions about what is the timing on getting either the first dose of the vaccine, the second dose of the vaccine, or booster if you've recently had COVID?
Yeah, that's a very, very common question right now. I assume the person who asked it has seen that this FDA has recently released a statement that the CDC has also added to their guidance documents that says someone with a recent COVID infection could decide to delay their first or second or booster dose for 3 months after their infection. So it's a good question. Like, what do we recommend? If you're eligible for the vaccine, do you get it now or do you wait? And for many of the reasons very similar to what Dr. Yagana has said, we have very high rates of transmission right now. We know that people want to go out and should go out and do activities and mix and have fun, which all comes with some sort of risk. So we think, LA County Department of Public Health thinks you should get vaccinated as soon as you're eligible. And for someone who is recently infected, that eligibility starts as soon as your acute infection is over and your isolation period is over. So basically 10 days after your symptoms started, as long as your symptoms have gone, your fever is gone and your symptoms are improving. So that's our answer. But I do understand that some people may choose to wait for an additional 3 months because they have some immunity from their infection.
Yeah, I think it's, again, people really, in some cases, you're going to need to look at your own individual situations and try to make the best assessment possible. We really urge people, if you live with people at higher risk, if you're a person at higher risk, then, take advantage of the fact that we live in a country with no shortage of vaccines and no shortage or ability to get easy access to boosters because you're at greater risk of, or somebody in your family is at greater risk of having, unfortunately, a severe illness or a really bad outcome should they get infected. So I think these are really good questions and always good to talk with your provider or give us a call and we can walk through your individual situations at our call center and try to give you more personalized advice. But these are great questions and we thank you so much for asking them. Dr. Davis, I'm going to turn to you for a second because we have a lot of questions about masks. So I'm going to start with, we have questions about should daycare centers, should children at daycare centers, children and staff at daycare centers be wearing masks again indoors? What about at schools? What about retail? What about on planes? Like just a lot of questions about when should we be wearing our masks?
So the answer is yes, you should wear your mask. We still have a strong recommendation, and that recommendation is even stronger given the amount of community transmission that we're seeing right now. We have continued to go up. We haven't quite plateaued yet. I don't know if we will, but there's just a lot of chances of being exposed out there right now. There are certain places that you're required to wear a mask, and that's going to be in your healthcare settings, as well as on public transportation in LA County and in transportation hubs, indoor transportation hubs as well. But we think at the moment, given what we're seeing, that yes, you should wear a mask, in those other settings as well. And I would say that especially if you are going to be around children that cannot be vaccinated, it's the one thing that will be most protective for them, in addition to all of those who are around them being vaccinated as well. So again, our recommendation right now is even when it's not required to wear a well-fitting mask indoors in public spaces.
And then do you want to talk just for a bit, because we have a whole set of questions about what is the best mask? What's the best mask for children? People are having a hard time, determining what do we mean when we say the mask fits well and that the mask does a good job of filtering.
Yeah, so when we first started, there were only a few choices. We started out with your bandanas, sort of multi-layer. You fold them up. Then we got more of your surgical procedural masks, which are better. And then we have more of your N95s, your KN95s, or KF94 masks, which are the best in terms of filtration and often have the best fit once you choose the right size for your face. Now, mask, in order to fit well, should cover your nose and your mouth completely. There shouldn't be any gaps in the side, especially when you talk. And in order to kind of check for that, you really put it on your face. You feel whether or not you're getting cold air coming in. You can also see when you talk if the mask is moving in and out as you talk and breathe, which means that there's good suction there, so it's a good fit. And we also have a lot of this available on our website under mask as well. But in general, the way to think about it is the best is going to be a well-fitting respirator. That's KN95, KN95, and KF94. Now, some of these are also available for children, and you can find those either in stores or sometimes online. The next best is going to be either double masking with a medical mask and a cloth mask over it, or a well-fitting medical mask with a brace around the nose or over the nose so that it can, close that gap. You can also tie the ends in order to close the gaps on the side as well. Those are going to be your better and best, or best and better mask in terms of what we're talking about nowadays.
Yeah, thanks so much. Dr. Morales Myers, there are some questions, and other people should chime in on this because I think this is another question that we got asked a lot. How can we have conversations with vaccine hesitant parents so that they'll feel more comfortable getting their children vaccinated? I know you head up all of our clinics, our mobile teams, and again, we want people who feel comfortable with the vaccine to come in and get vaccinated, but we know we need to have a lot of conversations with folks so that they'll feel comfortable. But I wonder if you have advice on how we can talk to each other, how we can talk to our friends, our family members who may still be vaccine hesitant.
That's a really important question. And it is important to first listen to the person to see where they're at and what their concerns are, and starting the conversation from where they're at. And so really getting to listen to them about what are their concerns, what is the hesitation, what is the barriers, and what's causing them to not get vaccinated. And then speaking to them about how to overcome those barriers. So it's really important to listen to folks and to hear where they're at right now, to start that conversation at where they're at. They can definitely speak to their doctors and make sure that they're speaking to their doctors and a trusted professional about the vaccines, and making sure that they're getting their questions answered by someone who has the information available. But it is really important to listen to our family members, to listen to our patients, and to listen to them, to hear just what is it that they're concerned about and try to address it, starting there.
Dr. Terashita, there are, again, a couple of questions from people who are fully vaxxed, boosted, wear their masks, but they're still worried about traveling. And these are questions in particular we've gotten from some of our seniors, and so thank you for joining us, where people are wondering, is it safe to travel? Is it safe to fly to the East Coast or to another community where cases are high right now? I want to note that cases are very high here as well. We're one of the highest case rates in the country at the moment. So the precautions we're taking here are similar to the precautions we're going to need to take if we travel. But I wonder what advice you would give folks who are feeling hesitant. There's even a question from someone who says, should I even be going out at all? I'm a person at higher risk.
Yeah, that is a very personal decision. And we do recommend that, if you have a lot of questions, that you do your research. We have a lot of information about travel on our website. I know the CDC has a very comprehensive travel guidance for COVID, as well as, you always can talk to your own physician or clinician. And it really depends. It depends on your risks and benefits. We all appreciate the fact that this person is fully vaccinated and boosted. I know that those who are fully vaccinated and boosted have a lot of safety. You have a lot of protection from the virus. It's not perfect, so there is some risk, but we do say, CDC allows fully vaccinated, boosted individuals to travel both domestically and internationally. Again, this can be found on the CDC travel guidance website. We do recommend that you get tested before and after you travel. We do recommend that you wear your mask, as Dr. Davis had said. Very important. And there's a lot of ways to travel and keep yourself safe. I fully believe that you can travel safely. But again, if you have underlying medical conditions, you're immune compromised, maybe you live with or are very close to someone who's immune compromised, I really recommend you talk it over with your clinician.
Yeah, I really appreciate that. I mean, we do get asked this all the time. And, while we know you can layer in a lot of safety, we also know nothing's perfect. And that people have gotten infected who have really, they're fully vaxxed, they're fully boosted, they're wearing their masks when they're around other people indoors. But there are circumstances, where they came into contact with somebody and the variants circulating right now are very infectious. They're very easy. It's very easy to transmit to someone else. So given that nothing's perfect, we do ask people to, look at your risk profile and then make decisions based on what's really important to you. It's not possible for people to stay completely isolated from everyone else for years on end. That's been very hard on many folks. And so you may need to decide, there are a few activities that you're going to do. You're going to layer in all those protections. What I tell people is also, please don't be afraid of asking other people to help you. I was talking with someone who wanted to have a few people over to their house for dinner, but they're immunocompromised, and they felt like, they wanted people to come over but test themselves before they came over, but they felt awkward about asking people to go ahead and test themselves. And we encourage you not to feel awkward. We're living through a pandemic, and I think most of us really want to do our best to take care of each other. And that means, like, if you're a person who is higher risk and I want to come and visit with you, I might need to keep my mask on when we're indoors. We may need to take our activities outside. We may need all to test before we're gathering so that we layer in that security. We appreciate, for some people, this has been much more frightening than others. And while a lot of attention has been given to people who feel like, the pandemic's over, we haven't given as much attention to people who are at higher risk and have good reason for being concerned. So I want you to know you have our full support, and we hope that you'll feel comfortable asking people around you to also take those steps that help you feel safer, and that actually do layer in more safety for you as well. People who have underlying health conditions, people who have disabilities, they're all essential members of our community, and we still have an obligation to use every prevention strategy we have available to protect those who are most vulnerable. There's nothing here that says we're entitled to be selfish about this. We all benefit if we're doing a better job taking care of each other, which may bring us to a couple of sort of last questions. One, Dr. Davis, I think this is super important. Can private businesses require vaccinations for children 5 and older? These are people who are going to art classes or they're in private schools. Can, in fact, there be requirements around vaccinations? And we also have questions, can private businesses require that everybody, workers and customers, are fully masked when they're indoors?
Well, the answer to both questions is yes. Not only do businesses, want to make the environment safe for their customers and visitors, but they also have an obligation to do as much as possible to protect their workers. And so they are able to do this in terms of requiring either masking or vaccinations or being fully vaccinated before entering into their spaces. And we actually have a number of businesses and organizations that are doing that now, where they're not required to do it, but in order to layer in those additional protections, both for their workers and those who are coming to their location, they are requiring vaccinations, proof of vaccination, and some are requiring that you wear a mask, and some are requiring both. They are able to do this, and you should really, wherever you're going to visit, know what they're going to require of you before you get there, just so you're best prepared to enter in that space according to their rules.
And then maybe we have only a couple of minutes left. So before we close, in closing, I think I'm going to somebody sent us, I think, a great question. And maybe all of our panelists, you can go ahead and sort of give like a 1-sentence, response, one recommendation. It's really, what are you doing or what should we be doing to prepare for this winter? So maybe I'll start with you, Dr. Morales Myers.
Great question. Preparing for winter, we have to make sure that we're vaccinated. That's key, and that's going to be number 1. So I'm going to say that.
Dr. Terashita?
Thanks. To add on to that, yes, I would prepare for an increase of cases this winter, layered on top of all of our normal winter diseases such as influenza, you can expect we will see some strain on our healthcare system, but I do echo Dr. Hema about please get your vaccine, all your vaccines, influenza, COVID, and protect yourselves and others. Thanks.
Dr. Jagane?
Yeah, I think, during the last couple of years, we have figured out a lot of different strategies to keep us safe. And so I think the layering of these strategies is really important. And of course, the base is vaccines, but also we do have things like personal protective equipment, wearing high quality masks. And then luckily we also have therapeutics, and we haven't had much time to talk about that. But if you are someone who's high risk, who does get infected, we do have a wide range of therapeutics available, some oral, some that you would have to get as an infusion, but all, highly effective. And I think hopefully we'll have more tools as we head into another winter. And these tools will help us from experiencing the kind of surges we've seen in hospitalizations and cases and deaths.
Dr. Davis?
I would echo what everybody else has said, but I'd also say pay attention to the guidance that we provide, in terms of what's happening and what you should be doing to protect yourself. It may change over time. We've seen that throughout this whole pandemic. So, staying up to date and knowing what's happening and what to do is one of the best ways to at least know where to start in terms of protecting yourself.
Yeah, thank you. I think that's such good advice. The only thing I would add is we have to get comfortable with the fact that, some things that we've been doing since the beginning, because they were our early tools, are still going to be really important tools. And when we're seeing increases in cases, we gotta be willing to use those tools again. So, I'm talking in particular about putting those masks back on. I know we're sick of them. I know we hate them. I know we don't want to wear them. It's a sign of caring for other people when you put that mask on. And we're going to need to be prepared this winter, particularly if we have any variants that are evading the protections from our vaccines, to go back to really understanding how important that masking protection is for all of us. The same thing around testing. We're so lucky that we've got access now easy access now to tests. Many people have access to free tests, so we're working hard to make sure everyone has access to free tests. But we need people then to use those tests, and most importantly, if you get a positive result, please stay home and away from others. I know people who have tested positive and they say, I have no symptoms, I'm not going to really worry about it. Well, we're going to worry about it for you. So, if you test positive, we do ask that you stay home, even if you have no symptoms. But with that, I want to thank everybody. You sent us amazing questions. We appreciate your being engaged with us tonight. We're always happy to hear from you and be as helpful as we can. I'm going to ask that as we're closing, we just flash the number of the call center on again, because this is where you can reach somebody 7 days a week, 12 hours a day to answer your questions. So with that, good night, stay safe, and have a good rest of the week.